Dr. Scheiner here again. There's Sally. Say hi, Sally.
Hi.
So hi. Okay, so as I mentioned before, we had some people tuning in before we showed our lip augmentation. I thought you hopefully you enjoyed that. And now we're doing something kind of cool, which is a technique to get rid of moles. You know, sometimes we have moles and they don't look the best on us. So I actually have a laser technique way to treat moles. What I do first is I have to make sure that the mole isn't dangerous. So first thing I do is we actually take a small piece of it and we send it for pathology to make sure that it's not dangerous. But once we make sure it's not dangerous, then we can then get rid of the rest of the mole with this laser. And the cool thing is that moles go all the way through the skin. So what I'll do, they go in like all the way through. So I'll take away, you know, half of it, so it's flush. And what's nice that way is we don't leave any scars that way, and then it's not cosmetically visible. As long as it's not dangerous, then that's a good thing to do because it doesn't show the mole as much and it's a cosmetically better result. And so we have a patient here, and to allow us, can I show your mole here? Okay, this is our generous patient, and he had a mole. Let me take this off here. Let me clean this. He has a mole that we actually already biopsied, and that's why there's a little red there, but it's still raised. And what we're going to do is actually use a laser, and we're going to laser that flat with this laser. So I'm going to turn this over. I'm going to turn this over to my assistant, Sally, and she's actually going to help us here. Okay? Hi, Sally.
Hi.
Okay, you can turn it. Okay.
I'm the one with the lips. No.
That's right. She was.
I'm the one with the lips.
She's the one with the lips. Well, we did. Sally actually showed her lips for science a little bit earlier today when we did our lip augmentation. And you have glasses on. You're good, right?
Yeah.
Okay. Okay. So what we have here, this is a laser. Can you see the laser, you guys? This is actually something called a erbium laser. It's really neat because erbium is very, very clean. It just takes away layers of skin. I use this for improving. You can pull back a little bit. I use this for improving. There's my funny glasses again. Give me some hearts if you like the glasses. Okay, so anyway, so this laser is really neat because we can use it to plane down the skin layer by layer, really precisely. When I do this on a more aggressive layer, and if you go to my website, you can see something called the reset procedure for sun damage. Look at those results. Go to my website, adamscheinermd.com, and you can see the results from that. I can get underneath skin lesions and improve the skin health and get wrinkles to go away and lines to go away. Now this is another application of this. I'm actually using this to plane down a mole that this person had. Sometimes we have these moles we don't care for, and so we can see the mole right here, and this is the laser. This is a really fine beam. It's about 2 millimeters in size, okay? 2 millimeter light. And that laser I'm going to use to plane down. You'll get to see this.
UK watching.
Oh, from the United Kingdom.
Can they do this in the UK?
Well, if you have the right person, but I have people coming from Dumbleton, England. Where was the other one from? We got a lot of people from England who fly out to see us.
A castle somewhere.
Middleton, it was about 4 hours north of London. They came, we had the mother and the daughter came in, right? Yeah, we have people come from England all the time. Okay, so, are you guys ready? Let me see some hearts if you guys are ready.
Got the hearts.
Okay, so you can see the little lesion here. Now you can zoom in there. I guess how we're going to do this, because you're going to put on the, you're going to be able to hold this with the other hand.
Oh, sure.
Do you want to be the smoker back here? Okay, so we have a, you can come down here, that's fine.
Let me do it.
Okay, so here we go. Let me get the light down a little bit, hold on.
We're getting set up.
There we go. So, okay, so here's the mole, and you're going to see me take it down layer by layer. You guys ready?
Ready.
Are you ready? Ready to rumble? No, just kidding. Okay, ready to laser. Okay, here we go. Are you doing okay?
Yeah.
So once again, with good anesthesia, guys, we keep people comfortable in what we're doing. It's getting there. So I want to get this flat with the surrounding tissue. That part's flat.
Got lots of hearts.
You guys are liking this?
Can you remove skin tag from armpits with this?
Yes, we can. That's almost flat. Is that cool?
Yeah.
So we have it almost flat. I'm going to fine tune it a little bit, but the cool thing now, if you guys can see, this was raised up and now it's just about flat with the surrounding tissue. And that's what I want. I mean, this was, we actually biopsied this to make sure, you can zoom in on me again. We actually biopsied to make sure it wasn't dangerous because we have to make sure medically we're doing the right thing. So the biopsy came back as not dangerous. And because of that, I can actually go over this. We have interesting comments? Okay. So we actually can go over this and I can remove this very precisely now that we know it's not dangerous. That's the most important thing, to make sure that it's benign or not a dangerous lesion. Now that it's not, I can fine tune this and plane this down so that people won't be able to see this mole anymore. And that's what I'm really excited about. Okay, let's keep going, guys.
Tampa, Florida, MLK, across the street from St. Joseph Hospital.
A little bit in the center here. We're actually very close to the airport. We have a lot of people who fly in to see us, and how many miles are we from the airport? Maybe six miles? Maybe about 6 miles from the airport. So people will fly in and fly out the same day very often to see us. So I say, yeah, we're very close to the airport. We have people fly they fly in for the day just for the treatment and they fly out. It's very easy. Tampa has the #2 best airport in the country. Very easy to get into, great flights here, and we service a lot of people around the world. So, okay, so I think we're just about done. That looks pretty good, huh?
Yeah, pretty flat.
Yeah, right. If his hair grows down here, because he's got those sideburns, let's go a little bit more around here. I think this looks good, but I will tell you, I think it's looked accurate done. And well, what do you guys think? Take a look here. Remember how raised it was? Can you see how flat that is now? Maybe if you come from the side, maybe if you can come from a little angle. So this is all right. It's all flat. This was raised up. And how many years did you have that mole there?
40.
40 years. He's 32, but he had it for 40 years. Okay.
You're funny.
Anyway, no, he had it for 40 years, and that's not nice. I mean, you know, it was sticking out, so if he wanted to shave, it was tough. It would get stuck. So this is really nice because this is flat, and really it could be 40 years before it grows back a little bit. So we're really excited to help him.
Is it painful?
Not at all.
So he said not. Yeah,
not at all. It's nothing.
Yeah, because we numbed him, and everything that I do, you saw the lips earlier. If you go on to Periscope, you can see the lip injection that we did. If you go on to Catch for Adam Scheiner, MD, you can see what else. What do we do?
Did we do Cabela?
The Kybella. You can see the Kybella actually, and you can catch these. You can catch these too. It's KATCH, Catch.com, Adam Scheiner, MD, and then you can watch these videos. But you'll see everything that I do. I really care about my patients a lot. I don't want them to have pain when we're doing it, so I'm really careful to make sure that we're giving good anesthesia. I think we're good. I can take these funny glasses. Okay, let me get some hearts if you want to take the funny glasses off.
I think they like them.
No heart set? You want me to keep the glasses on?
Keep them on.
Okay, well, I want to take it off so I can see you guys better. Okay. So did you find that interesting?
Bill Nye the Mole Guy. That's
Bill
cute.
Nye. Well, you know, actually, I know Bill Nye. I've met him a couple times. He's a great guy.
Any contraindications to having this done?
No, only if it comes back as something dangerous if it came back as a melanoma or basal cell carcinoma or squamous cell carcinoma or Merkel cell carcinoma, something dangerous, then we can't do this. Reality is that most of these moles are benign, and he's going to love this because he won't have this lesion here anymore. And for all those other lesions, this is really safe. And so guys, also, I'm going to give a little shout out. This is something called Caricure. This is actually by a colleague of mine. This is an advanced healing solution. It's pretty neat. So this little white thing I sprayed on here, this is actually a polymer that will grow over a wound and actually seal the wound. And we've been using this a lot for things like this because this way we don't have to put a Band-Aid on it. This will actually stay for a couple days and keep it clean.
That's so cool.
And you can actually use this at home. This is available in different stores. I think Publix might be carrying this, maybe Walgreens, but it was developed by a PhD, Carrie-Ann Greenlaw here in Tampa. And this is actually really neat, Caricure. And so this is, I'll show you, this is it's a spray. Let me see if I can show, well, something dark. Well, I'll just try it on here. But this is actually a spray. And the spray, you can use this for wounds. I mean, I sprayed on here. It forms this nice bond over there. And so I didn't have to put a Band-Aid or any sutures or anything on this. And it's going to be really easy for him to take care of. Yeah. So that's going to dry right now. Watch burns. So do you guys have any questions about anything? Any other questions before we sign off? And yeah, definitely, I would say is like our channel. If you can follow us on Periscope, you can become fans of our Facebook fan page, our Twitter. Also, Adam Scheiner MD is what you'll find us under. And once again, it's really fun talking with you guys. Any last questions from anybody? Okay, we give hearts to the patient who donated his time.
Lots of
hearts.
hearts.
You guys are awesome. You are awesome. Thanks for sharing.
Thank you.
Okay, well, bye, guys.